And as you are coming into our Zoom room, if you could kindly just mute yourself so that we can allow for a very free-flowing day, and just turn off your cameras where possible, please. That would be greatly appreciated. So once again, welcome to our conference. Welcome to the Place of Philanthropy and Community Mental Health. My name is Irina Hovrenkov, and I'm an associate professor with the Johnson Shriyama Graduate School of Public Policy at the University of Regina. My colleague and co-host of this conference is Dr. Lynn Gidluck, who leads the University of Regina's Community Engagement and Research Center. And we're just so delighted to welcome you to our event. We're thrilled so many people from across the country are able to join us today, and we're really excited to learn where you're joining us. So if you could kindly fill out a short survey, which will be posted in the chat box, just for us to learn a little bit about the demographics, that would be greatly appreciated. While our event is virtual, it is important to acknowledge that we, as your hosts, are located in the Treaty 4 territory in Regina, Saskatchewan, the traditional home of the Niiwak, Anishinaabeg, Nakota, Dakota, Lakota First Nations, and homeland of the Métis. I would also like to acknowledge that this conference is sponsored by the Canadian Philanthropy Partnership Network, which is a national research network supported by the Social Sciences and Humanities Research Council, and also a number of grant-making foundations and organizations working to advance the interests of the philanthropic sector. Together, Lynn and I are the co-directors of the Western Hub of this national research network. All of the projects that receive funding from this network have to pass the Community First test, where researchers must demonstrate to the funding committee that community-driven needs are at the heart of the work they propose to do. Community partners play a key role in defining the research questions and ensuring that the projects meet the needs of the communities they serve. And so one of the goals of this conference is to bring together communities, researchers, colleagues from academia, and members from the grant-making sector to share information, resources, and ideas. And with no further delay, I would like to introduce you. I'm so honored and delighted to introduce you to our two fabulous keynote speakers, Margaret Eaton and Dr. Lindsay Richardson, who are very accomplished women. Margaret Eaton is a national CEO of the Canadian Mental Health Association. Under Margaret's leadership, CMHA ranked 6th on the Forbes list of Canada's best employers. And in 2021, Margaret was named one of the Hill Times top 100 lobbyists. It is real testimony to the work Margaret has done in propelling the topic of community mental health to the top of the Canadian public minds this past year. Dr. Lindsay Richardson is an associate professor at the University of Regina, or the University of British Columbia. Lindsay, you're such a wonderful academic. We probably want you at our institution as well. And she's also a research scientist with the British Columbia Center on Substance Use. Her research has been extensively published in many leading academic journals. She has been interviewed numerous times by the mainstream media and made many public appearances to share her research, which connects substance use with social determinants of health. Margaret and Lindsay, welcome to our conference. And thank you so much for making the time to share your perspectives on the issues around mental health with all of us. I would like to just quickly note that only the presentations will be recorded today. We will not be recording the question part of this session, just to allow for that free-flowing and sincere discussion. So with no further ado, I would like to pass the torch to Margaret to make her keynote address.
Thank you very much, everybody. I appreciate your patience. And I'm really delighted to be here to speak with you about the mental health impacts of COVID-19. So today I want to talk a little bit about the CMHA, if you don't know about us. I want to talk about the impact of COVID-19 on mental health of Canadians, but also the impact on our organizations, how the government responded, and what we hope might happen next. So to tell you about us, we were founded in 1918. Curiously, we were founded in the middle of the Spanish flu pandemic, right after the end of the First World War. We are now in 330 communities across 10 provinces and the Yukon Territory. And we offer a range of programs, services, and supports to over 1.3 million Canadians annually, including our Mental Health Week promotion, which we just had in May, which encouraged people to name it, don't numb it. So name your feelings as a better way of dealing with them than numbing them. So to tell you first about the impact of COVID-19 on mental health, we worked with UBC on a series of research reports where we tested the waters with Canadians approximately once every 4 to 5 months, starting last June. And the numbers were fairly consistent when we look at what the impacts are. So the general population, Canadians overall said that 41% of them had experienced worsening mental health. But our particular interest was with vulnerable populations. We had seen a lot of research that talked about how were Canadians feeling, but we particularly wanted to know, was it worse for people who were in a more vulnerable situation? So you can see in this slide, people with a pre-existing mental health condition were faring much worse. 61% of them said that they had worse mental health. Similarly, people with a disability, households with children less than 18 years old, parents, the LGBTQ community, people who are unemployed, of course, and women. If we look at women's mental health versus men, 44% of women said that their mental health had worsened versus only 32% of men. That could be because women are more comfortable talking about their emotions, but it could also be that, as many commentators have noted, the impact of the pandemic on women's mental health seemed to have been worse. Women oftentimes ended up caught between a job and taking care of children, especially with children being out of school. They also disproportionately have to support their parents and the elder population. And so women were really feeling the squeeze. Women also were more likely to have lost work during the pandemic in traditional areas like restaurants, hospitality, tourism, where women are overrepresented. This was a sad one. There were concerns amongst 18% of the population about having enough food to put on the table. And that was the scary part of the shutdown of the economy. And if we look at suicidality, in any given year, about 2.5% of Canadians say that they have suicidal thoughts. During the pandemic, that number rose to 10% of the general population. And if we look at vulnerable populations, again, you'll see those numbers are much, much higher. And we particularly looked at the impact on parents. 45% of parents said they were stressed because of financial concerns. We saw an increase in alcohol consumption around this group and an increase in suicidal thoughts, 9% of parents saying that they had suicidal thoughts. So why do we feel so awful? Well, it's all of these things and the combination of these things. Social isolation has been huge. We found out just how dependent we are on each other, and being apart from each other has been painful. There's been lots of fear of the future and the unknown, not really knowing when it will end. And thankfully, we're seeing a little bit of a light at the end of the tunnel now. But there's also, with that, a fear of returning to normal. So what will it be like when we try to get back into the world, when we've been out of the world for so long? There are, of course, health concerns for ourselves, for our family, for friends, financial concerns, which are huge for many people. Wages, rents, loans coming due. When we saw the wage subsidy come through from the federal government, we saw that as a mental health program so that people would have that financial, social determinant of health, having the financial means to carry on. There's been tremendous change for many of us in white collar roles. The pivot to working from home has not been an entirely perfect. There's boredom and monotony. And there's lots of grief from loss, of course, from death, but also from lost opportunity and a feeling of lost time. So if we look then at charitable organizations and CMHA in particular, what impact did it have on our CMHAs? We have 86 organizations across the country, all carrying a heavy load during this time period. One was there was a much more increased demand for our services. So as you can imagine, the phones were ringing off the hook at our CMHAs very shortly after the lockdown began. In some places, calls were up 100, 200% over previous times. And in terms of our suicide lines, some of our CMHA branches are part of the National Suicide Crisis Line. Those numbers were incredibly high as well for people wanting counseling and support through suicide ideation. We heard from new people, new clients that we had not heard from before, people that were not normal users of our services. And then in addition to the mental health demand, there was also a lot of demand on our CMHAs from governments. So provincial and regional local governments asking us to sit on tables. There were so many new advisory groups that were formed in order to find out what should we do next. And so CMHAs were called on, in addition to meeting that client demand, to actually meet the demand of government. And similarly, media requests were also up across the country as the media wanted to cover what was going on in mental health. Of course, we all pivoted to virtual services. During total lockdown, programs that would have been delivered in person switched to virtual, and that was a new experience, especially for clients who might not have had the technology. There was a rush at CMHAs to try to fill the technology gaps for those who might not have been able to afford or have access to those services. So some of our branches are very proud of the fact that no programs were dropped, that they found ways to deliver. You know, some of them were delivering food. They were concerned about clients who would have come to their drop-in centers, their clubs, and concerned that they weren't getting enough to eat. And so our staff were doing things like packing up sandwiches and making sure that clients had food. So that was a tricky turnaround, but one that we're very, very proud of. Thirdly, government funding and corporate donations in particular, and individual donations increased. And that's a wonderful thing in many ways. This happened at the national office as in addition to the regions and branches. And sometimes it was donors calling. We had one saying, here's $250,000. Do whatever you need to do to help people out at this time. And so we were able to distribute that funding across the country. And it was unrestricted, which was very powerful for us because it meant that money could go out and be spent in very different ways across the country, depending on what the needs of the organization were. At the same time, too, the double-edged sword of new funding, especially if it's program funding or restricted funding, is you have to spend it, which might mean getting out and hiring, starting up something brand new in place of what you were doing before. So that also created additional stress. And finally, our staff are feeling burned out and stressed. I've heard this across the country, that it's been a really hard, long year. And while we're delighted with the success that we've experienced, it's been a tough go for everyone. So how are governments supporting community agencies and really stepping up? Well, we were very pleased that both the federal and provincial governments across the country have invested in mental health funding. And we saw big increases in funding, for example, for our Bounce Back program, which is a virtual cognitive behavioral therapy program. This program was funded in Ontario and British Columbia, but there was new funding in Quebec, in New Brunswick, and we got some national funding for Bounce Back to ensure that everyone across the country has access to that virtual program. In 2021's federal budget, there was almost $1 billion allocated for mental health. And even separate above and beyond that, we saw another $400 million to create this temporary community services recovery fund. And I think this is to help those organizations that saw reduced funding, unlike CMHA, which all of us across the country saw increased funding. Some charitable organizations actually saw quite a large drop in funding and laid off staff. So this is to provide some additional support to agencies who are helping their clients to recover. And we're still waiting for details on what this might look like and how it will roll out. But we've been really excited that there's been this recognition. And I would say beyond that, in our conversations with the government, there was a real sense that they're concerned about mental health and that this is a priority for them. And that they were also very concerned about funding grassroots organizations. The way that the Canada Health Act works is that funding for mental health comes through the federal government in the form of transfers to the provinces. The federal government had made a big increase in mental health funding, but they didn't know how it was being spent, whether the provinces had actually spent it on mental health, and what the impact had been. And so there was very much a desire on their part to reach out to grassroots organizations to be able to fund directly and have a direct impact on mental health, sort of circumventing the provinces, if you will. So just as an example of that, the Public Health Agency of Canada has $100 million to support vulnerable populations who have been impacted, their mental health has been impacted by COVID-19. So we're very much hoping that our community mental health agencies, not just CMHAs, but others, will have access to that funding, which could be substantial and transformational for vulnerable communities. So we're happy to see this sort of switch in thinking at the federal level to recognize the importance of community mental health. So what should happen in the longer term? Well, we're very concerned that the long-term impact of COVID-19 will be profound. We've talked about the echo pandemic of mental health. And what we found in the case of other kinds of epidemics or natural disasters is that even after the physical effects have been mitigated, even if we're going back to work and things feel normal, it's at that point that people oftentimes find that they experience the worst of the mental effects of the situation. So, for example, in Fort McMurray, after the fires, we found that even after people had returned home and things were kind of back to normal, it took up to 18 months to 2 years for those who had been experiencing that awful occurrence to actually get back to better mental health. So our phones in our branch, our CMHA branch in the region, we're still getting calls from people up to 2 years later. So we think that the same thing will happen through the pandemic. And it will be a tough transition for many people to go back to work, back to school, to feel comfortable, and to put aside those anxieties that they've felt over the last year. And we know that economic recovery will depend on having a well workforce. But even aside from the pandemic, we were all struggling with mental health well before the pandemic. Our research shows that 1.6 million Canadians reported unmet mental health needs prior to the pandemic, and that would be annually. 85% of Canadians believe that mental health services are underfunded. 53% of Canadians believe anxiety and depression is epidemic. And mental illness has a high cost for our economy and our society, with depression growing. So that was happening before the pandemic. And what we see through this pandemic is a kind of opportunity that because so many people have experienced anxiety and depression, that it has normalized what many people live with on a regular basis. And so there is a feeling amongst all of us here that the time for us to make a big change and to ask for a big change of governments is now. that we really need to take advantage of the moment and the opportunity that COVID-19 has afforded us. So we're looking for a long-term solution, and we believe that it is universal mental health care. Our current healthcare system really provides fairly inadequately for mental health, and I don't think people feel that there is a clear pathway if you have a mental health concern or a challenge. And what people really want is a kind of one-stop shop. They don't want wait lists. They want to know where they can go to be seen to get help immediately. Almost like having triage or an ER, the same sorts of things that we would have. If you broke your arm, we would know exactly where to go and what to do and what kind of help to expect. We should have the same kind of thing for anxiety and depression, which are sort of like the common cold of mental health. Other countries have this. I was very fortunate to be in Germany and speaking with a young person there who is a tour guide, and he told me that he formerly had been a dancer. And I said, "Oh, why are you not dancing now?" And he said, "Well, I had some mental health issues, and so I got some help. And it was wonderful to be here in Berlin. There were fantastic supports for me. I got all the help I needed. I got some employment help afterwards, and I got a subsidy to my wages so that I didn't have to worry about finances while I was taking care of my mental health." And I just thought, why don't we have that? First, he spoke so openly about his challenges with me. We'd barely met, and he was telling me about mental health issues. And he found that wraparound care that he needed that I would love to see all Canadians have. We also believe with that, the community mental health organizations should play a key role. That mental health isn't just about doctors and hospitals, but it's about funding a community approach, a wraparound approach, so that community care, which has been longstanding in Canada, as I mentioned, over 100 years, we've had community mental health care that has been trying to fill a gap that the regular health system has not filled. That needs to continue, but with appropriate funding and with appropriate connections back to the regular healthcare system. So we really hope that mental health will be more of a priority. There's an election, a federal election coming up this fall, and we are now getting prepared to really make the case for universal mental health care for all and for a fully functioning and appropriately working mental health care system where all Canadians feel that they can get the help that they need when they need it. So thank you very much for having me here today. I look forward to your questions. Thank you again for your patience as I fiddled with my technology. And I look forward to hearing Lindsay. Thanks so much.